I'm your host, Fatima. Today we're going to talk about social network activism, and we will also give you a glimpse of a recent Joyful Joy fundraising event held in New York City. Co-founder of the Joyful Joy Foundation will also give us more insights into what the organization stands for. So without further ado, let's get the ball rolling with the street trivia. Hope you enjoy. When you think of malaria, what comes to mind?
It's communicable. Some of the characteristics, some of the symptoms.
Pretty much insects and disease that's caused from insect bites or mosquitoes primarily. I'm not the most experienced in the subject, but that's what I'm guessing. That's what comes to mind.
So what comes to mind when you think of malaria?
Help.
Help.
Yeah.
Why do you say that?
Because they need to help them. What you say?
Africa.
Okay, what else?
Children. Sickness. Infectious diseases. Actually, I don't know.
Really?
Yeah.
Malaria occurs when somebody gets bitten by a mosquito.
Okay.
And it may take 2 to a couple of hours for the symptom to start, affecting the person, and they start having fevers, or they might start vomiting, having nausea, things like that.
When I think about malaria, I think about other diseases like smallpox and stuff like that, because when I heard of malaria, that's what I heard it all at the same time.
Okay, what else comes to mind?
Third world countries, kids, not having medicine, stuff like that.
Okay,
The
what?
need for help.
The need for help, you
Yeah.
said? Exactly. What are the symptoms of malaria?
What are the symptoms of malaria? Fever, high temperature, let's see.
I got hives, itching. I gotta assume it's a really terrible mosquito bite that maybe affects some other organs possibly.
Maybe diarrhea.
Uh-huh.
Vomiting.
Uh-huh.
There's more.
Yes, there's more.
I'm sure there are a lot, but am I right about nausea or diarrhea? Yeah.
Uh-huh.
Malnourishment.
Nausea, vomiting.
I said vomiting.
Yes, you did. I told you. You got it right.
Okay, yeah.
I don't know the symptoms.
If you had to guess.
I would say like some type of skin rash or
Okay.
some type of vomiting or something.
Vomiting, yes.
Something within the body, not so much like outside.
Okay.
I graduated a few years ago, so now I'm trying to dig deep into my my science.
Okay.
We should try to take care of ourselves pretty much, and try to, clean our hands, wash our hands, because anything that we touch, anybody else can touch, and mosquitoes, food, all that good stuff.
Exactly.
Mm.
It's easy for people to point fingers and say that social network activism or charity work is not effective. So we decided to go on the street to ask people what they would do if they were to win $1 million. What would you do with it? Here's what they had to say. But I would like to know, what would you do if you were to win $1 million?
$1 million? After or before taxes?
I would definitely help the children, children in need, give it to the church, help those who've been kidnapped. Now I know.
What would I do with it?
Pay my bills.
Well, I'd pay off all my bills, but I would give money to my church. I would give to a soup kitchen that I believe in called Holy Apostles. They have the biggest soup kitchen in the city. I'd give them, they might have to close, so I'd give a lot of money to Holy Apostles, and I'd donate money to my church, which does help other churches that have social causes.
If I were to win $1 million, and let's prioritize, I would first of all pay off all my debts, and I would pay my mom's off as well. And then I would probably go back to school and invest something, anything that is investable.
I will pay my debt. I'll pay my debt off. So IRS, all of you people, I'll be paying you. Secondly, I'll be honest with you. I believe in helping people through getting money. So more or less, I'm big on humanitarian philanthropy, you understand? Things of that sort. So I would definitely go to certain places and help out certain countries. And it doesn't have to necessarily be Africa. You know, I mean, we right here in America, you know, we have so much poverty that, you know, some of our people that's from Africa and other countries feel like because we're here, we're rich. You know, and we're definitely not. A lot of people right here need help, but I would do the hands-on help. You know, I wouldn't be donating to any kind of funds or any kind of nonprofits. I would probably make my own and go down there and work hands-on to build education, healthcare, you know, infrastructures, so on and so forth.
Oh dear, I would have to make sure I want to be more practical with it. I want to first pay rent, then just figure out everything else from there.
$1 million. I would probably go back to my country and help out over there because a lot of poverty, and that's the reason why I'm here in this country, to have money and help back. So yeah, I'll just go back and help.
Our special guest for today is Sue Garrow. She is the co-founder and managing director of the Joyful Joy Foundation, a nonprofit organization which strives to reduce the spread of malaria. Through their network of professionals, corporate sponsors, and celebrity supporters, Joyful Joy has partnered with health professionals to test and treat thousands of people for malaria, providing health education, distributing bed nets, and providing sustainable access to clean water since its founding in 2011. I caught up with the vibrant and enthusiastic Sue at a New York summit. Here's what she had to say. Hello viewers and welcome back. I'm sitting here with the co-founder of the Joyful Joy Foundation, Sue Garrow. Thank you for joining me today, Ms. Sue.
Thank you for having me.
So I understand that you just had your second annual fundraiser. Please tell me about that.
Well, it was our anniversary celebration and it commemorates our 2 years in existence. We officially launched May 22nd, 2012. We're really excited about that because, you know, most nonprofits fail in their first 2 years. It also is a celebration of our namesake, Joy Ighodaro. You know, a lot of the people that support us know a bit about what our vision was for beginning this organization. And Joy, you know, she was the sister to Osas Ighodaro, our founder, and she passed away due to malaria. And at the time, it was thought to be complications of her pregnancy. And by the time it was found, you know, it was learned that it was malaria, it was too late. But Joyful Joy serves in her honor to, you know, sustain life and to protect lives. You know, it's a mission to spread more joy, you know, so that we can honor the people that are here and prevent deaths. So instead of mourning the loss and being angry, OSAS decided let's do something different. So together we formed Joyful Joy, and we're creating a legacy here of change, of strength, of love, and we have an amazing group of people that have come to support us. We had our anniversary celebration at Motivo.
Yes.
It was hosted by our founder, Osas Ighodaro, and she's a native daughter of Nigeria. She's an actor, a model, and she's currently starring on Tinsel, you know, one of the #1 television programs in Africa. Mm-hmm. And she just got working for Colored Girls, the production that's taking place in Nigeria. So there's a lot of stuff going on with her. We're really proud of her. And yes, she hosted along with Malik Yoba.
Exactly.
So we had a great time, a great turnout. We raised some money, but more importantly, we were able to spread our message. We had a number of executives that supported us from Credit Suisse, a number of their staff persons who actually volunteered. We had Roman Oben, a former New York Giants, who's a current sports commentator.
Yes.
And people from various sectors, you know, of different businesses and disciplines, nonprofit, private sector. Everyone poured in to just share their support. They learned a lot about malaria that night, the work that we're doing. So it was a great night.
Yeah, and actually at the end of this interview, we're actually gonna show the video of the actual event, so our viewers will enjoy that. But how did you and Osas get connected?
Through a mutual friend. So that's kind of how, well, it started with a friend that we've both I've known for over 20 years. So he introduced me to OSAS. We got along from the very beginning. I just really respected how hard she worked at her craft. She was working at being, how do you say? She wanted to be a working artist, and she would go through so much just to make sure that she stayed on top of her craft practices and going and doing the go-sees and speaking to people. And I just really respected that about her. And then I saw that translated to other disciplines in her life with her family and her friends.
Exactly.
And so we just got along really well from the beginning, and I supported her with various projects and undertakings. And so that's how it developed, from a nurturing, I guess, place, and it just continued to grow. So naturally, when she shared the story of her sister,
yes.
We did want to collectively do something, and we tabled it for a little bit, and we said, we'd get to it when it was a convenient time. And then she went to Nigeria, to the Niger Delta, to film a documentary.
Okay.
And when she came back, she told me about what she'd experienced. She saw a man put his hand in the water and it came up black, and a hospital that she visited, and there weren't enough supplies or medication or health physicians.
Wow.
So there were those stories and countless others, the gas fires, and it was then that we said, you know what, there will never be a convenient enough time. We are just going to do something now.
So do you guys plan on branching into other African countries?
Yes, right now we're working in Nigeria, and it's only because of our capacity. Like, our vision, our mission is to see an end to malaria-related deaths in Africa, period. Right now, because we have the limited capacity, we are not able to go into numerous nations at one time. So we're committed to Nigeria. That's where OSAS is from. That's where there's the largest burden of malaria. So that's where we're working. And as we are able to build our capacity, we will take the models that are working in place and bring those, successes to other nations. And of course, a big part of what we do is adjust our offerings, our services, to meet the needs of communities. So we'll take something that works, and it's still a living, flexible model, and we will bring that to another city, state, community, in another nation, and shape that based on what the community's needs are there.
That sounds amazing. You guys are doing a great job.
Thank you.
So, I know you're not Nigerian, of course.
Of course.
So, what draws you to this cause?
This is like my child that I'm raising, we're partners together to raising this beautiful child, and we have villages of people that are supporting the work. So it's kind of funny, 'cause this is not the first time that someone's asked this question, and in my mind, I kind of think of, they say a smart person learns from their mistakes, and a wise person from the mistakes of others. So I did not need to see someone physically in front of me infected by malaria and going through that challenge. I didn't need to see that. I heard countless stories told by people that I care about and people that I've never met before. But those stories are real to me and they are personal to me. I really encourage people to do something. So it doesn't have to be that you send money. $1 helps, $5 help. Sometimes people aren't willing to send money because they think, this won't change anything.
Yes.
But it does. It honestly makes a big difference.
Exactly.
So send what you can from your heart. It's we are 501c3, and we're registered both in the U.S. and in Nigeria as an NGO. So it's a tax-deductible donation. And if you aren't able to send a monetary gift, then send yourself. We need people to help us with our website, with social media, whatever you're good, whatever discipline that you've sat down and said, I'm dedicating myself to this and you are excelling in, we can probably use some support with that. So whatever you're good at, if you're good at songwriting, write a song that's a backdrop for Joyful Joy.
Wow.
Write a poem, whatever you can give, because I'm a simple person from Brooklyn. I respect that, I love that. I will stay simple to the day I die. But I decided to stand up and do something alongside my sister who decided to stand up and do something. So collectively we're stronger. I just wanted to share a few things, that I learned when I was in Nigeria. There are so many misconceptions about what malaria is. There are many people who think malaria is contracted by staying out in the sun too long or eating too much palm oil or witchcraft and many other reasons. Not that they aren't completely unfounded. Not that they are completely unfounded. There may be some relevance there, but the reason people catch malaria is because of a mosquito. It's the female anaphylum mosquito, and they carry a plasmodium parasite. So when that's deposited into when they bite you and that's deposited into your bloodstream, it's a parasite that's living in your body and it will multiply. So malaria is not a simple disease. It is something that is tragic and it will cause death. And there's absolutely no reason for people to die. Some people think that when they contract it, it's like the flu, common cold, and it'll run its course. You don't want it to run its course because then you won't be here with us. So a part of what we do is raising visibility about what this really is and educating people as best we can so that people think differently about the disease and there's more interest in changing it. I think when you're complacent and you think it's a part of the fabric of your nation, you aren't doing your best to rid yourself of that burden. So we do a lot of work. We want to do a lot more work in that space.
Well, you've heard her, people. Every bit counts, and it doesn't have to be monetary. You can also volunteer your time and your skills to support the Joyful Joy Foundation. Next up is the highlight reel of the event held by the Joyful Joy Foundation, in which they fundraised to help eliminate malaria in Nigeria and other African countries. Here it is.
Looking forward to meeting good friends, connecting, making a few donations, leaving with my wallet a bit lighter. Deservingly so because it's a great cause.
Very actually appreciative of what Sue and us are doing because they're bringing awareness to a disease that we are afraid of addressing. We are very much about HIV/AIDS because it's out there, because everybody, the government, international community is focused on HIV/AIDS. But there is not enough of Africans learning about and really asking governments to support preventive measures.
And I'm very glad that Joyful Joy is actually on ground and they're doing stuff. We need all the resources we can get. We need nets in Africa. We need malaria pills to cure people that are sick, and we need more attention. We need the government to do more.
Especially a lot of people in America don't realize how severe malaria is. So, bringing awareness to the disease and the causes and anything you can do that's preventative makes it a lot more helpful.
Welcome back. That was a very fun and effective event, well worth the experience. Well, that's the show for today. I hope you enjoyed and was able to learn a thing or two. I want to thank everyone who was featured. I also want to give a huge thank you to the viewers for watching. Please join me next time as I uncover more stories from the diaspora. Goodbye.